Hello, hello. Welcome everyone. My name is Stanislav, and I am here with Andela, in charge of the health insurance program. We're super excited to have you join the webinar today to talk about available health insurance options. We have partnered with a wonderful company called SafetyWing in December to bring in those health insurance options to you. And so today is a great opportunity for you to learn about what's being offered, learn about the benefits, the premiums, specific terms, and also it's a great opportunity for you to ask any pending questions that you have. So there is a section if it's your first time joining the webinar with Andela, it might be a little confusing at first, but on the left hand side, you can see a section. It's sort of like a white background section, but at the very top there, you can see there are four tabs: chat, QA, polls, and people. And so under the QA section or chat section, as we go through the presentation today, please feel free to put in any questions you have. We will keep track of all those questions coming in, and at the very end of the webinar, we'll be addressing them in the order they were received. So make sure to make the best use of your time today since you're already joining, and go ahead and shoot those questions over our way. So just just to make sure that people that are joining the webinar, this is a webinar specific to Pakistan today. So if you happen to join from somewhere else, that might not be the best webinar for you. But if you are joining from Pakistan, please let me know where you're joining in from. Joining so that way we just kind of get an idea where people are coming from. I'm myself based out of New York City in the States, so this is where I am. And we are also joined today by Daniel. Daniel is actually on my team, and he focuses on the edtech products and things like that. So if you ever have a question about partnerships with educational products and services, feel free to message him on the Andela chat. He is helping us to set up the webinar and make sure everything goes smoothly. And then we also joined by Mar. Mar is our account manager at SafetyWing. She is based out of Colombia, and she's the one who's going to be giving the presentation today and answering all your questions and stuff. Wasif and Peculiar, welcome, welcome. Thank you for joining. So with that said, we're just gonna go ahead and run the first ball. Just want to see if you guys currently have any a health insurance plan. Just gonna gauge if you're actively looking to get one and just sort of curious to learn what's being offered through Andela. So I think it's a good time to go ahead and launch the ball. And the under the poll tab on the left hand side, you will see do you currently have a health insurance coverage. So feel free to go in there and submit your answer. And that should be good for now. So I just also want to spend a little bit before we go into the presentation. I just wanted to spend a little bit of time to talk about the partnership itself, and we Andela is super excited to be partnering with SafetyWing for a variety of different reasons. And at Andela here with the health insurance program, we're really trying to bridge the gap between being a full-time employee and a contractor. Now, Andela as a company is based out of the US, and we have to be compliant with the laws and regulations here. And since we're on the contractor model with you guys, we are legally we're limited in what we can actually sponsor when it comes to certain benefits and stuff like that. And so health insurance unfortunately is not one of those benefits that we can support you in. But the work we're doing is essentially find reliable providers negotiate down, the terms and premiums to make sure that we're bringing to you something super valuable. And with SafetyWing, we were able to do exactly that. So not only we were able to get super competitive rates for you, but also SafetyWing is also a global provider, and they have a mission that aligns super closely with what we do on the larger scale of things as well. And so this is definitely a marriage made in, in the sky, so to say. So I'm Mar. I'm gonna just give you a few minutes to introduce yourself, and maybe we will I'll go ahead and ask you a few questions so people get an idea about SafetyWing. Um, Over to you.
Of course. Well, first of all, thank you very much for inviting me here. I'm really excited to introduce to all of you something about safe doing and our product Remote Health. I am Mararango, as Stan mentioned, usually based in Medellin, Colombia, but we are a fully remote company, so I will be wandering around the world, just seeing everything and enjoying a little bit. And well, happy to have these partnerships with Andela. And yes, of course, let me know which questions
Mm.
you have, and I'm happy to help.
Yeah, definitely. So tell us what makes SafetyWin one of the most innovative health insurance providers? How do you
Well,
guys
this
stand out?
Yeah, well, actually, our main goal is to create a country on the internet. And I know this will raise a lot of questions. What does it mean, a country on the internet? What is that? And it's basically we are trying to create a global safety net for remote workers everywhere they are, and no matter their country, no matter if they move around. So we want to ensure equal opportunity and freedom for everyone, regardless of their country of residence. Also, if they're nomads, if they're remote workers, we want to make life easier for everyone.
That's awesome. And in Andela being a global company as well, where we have software engineers based out of literally all over the world, in Pakistan specifically, that's just a great product to bring in. What do you like the most about partnering with Andela
Well, I think
personally?
our both our missions really aligned. We are looking to create a world where geographies will not limit you, and we want to provide opportunities. You are building and creating opportunities in the work environment. We are creating opportunities in your safe, and so every member is safe and needs has everything they need to actually have a comfortable life as well. So I think we're both aiming to create this borderless world and help out with the breach we have between countries and things like that. So I think that is definitely a wonderful thing.
Oh yeah, for sure. I'm personally super excited as well. And you guys being global, it just means that we can potentially introduce you to not just Pakistan, but some other countries as well. But the value proposition always comes first. And I think you guys are delivering on that really damn well. So with that, we're gonna go ahead and run the second poll. I just want to get your guys' idea on if you are actively looking for a health insurance plan, how many people you're looking to insure. Is it just yourself? Is it yourself and a spouse or a partner? Or are you looking to insure your entire so let's go ahead and run that. I see some questions coming in already. YC for the win. That's awesome. Just also a reminder to those that just maybe joined a few minutes ago. Um, we are going to be going through a presentation just in a little bit, but as you have, if you have any questions that are coming up, feel free to share them out. On the left hand side, you'll see there is kind of like a wide section here, and at the top there are four tabs: chat, QA, policy, people. So under the QA tab or the chat too, you can submit your question here. All the questions are super important. This is a great opportunity for you to address anything pending or any concerns or um, something that you don't understand about the plans here, and we will go ahead and address those questions right after the presentation. So just make sure to make the best use of your time today. Alrighty, so I think we are probably good to go, Mark. So I'm gonna hand it over to you, and we're gonna move forward with the presentation. Um, let's do it.
Okay, perfect. Well, once again, welcome to SafetyWing and to Remote Health. This is our comprehensive health insurance, and I will go through uh, during this presentation on how to use the insurance, what are the different plans, the prices, how it works, how to use it in your own country, in other countries, and well, let's go ahead. So first of all, a little bit about SafetyWing. So as I said earlier, we're building a global safety net for remote workers, and we are seeking to change the world for the better. We want to ensure equal opportunity and freedom for everyone. And well, today, as I said, I'm going to talk about remote health. So why remote health and what is my favorite advantage about it? So we have a worldwide network. You can use your insurance with any private or public hospital or any doctor anywhere in the world. We are covering in over 175 countries. So if you are traveling, if it's also your home country, you are covered exactly the same no matter where. So you can just go ahead and travel as well. So you can choose to enroll in any of these three and in any of these two options displayed here, the standard or premium plan. All plans include a core package a core package. This is for $1.5 million. You also have an outpatient benefit for $5,000 with a zero deductible. I will explain a little bit better these two benefits in the next slides. So remote health will cover you for a mixture of medical necessary and routine care. So what is that? Medically necessary means that you have an injury, an illness, or a disease, and it needs to be addressed by a medical professional. On the other hand, if you're seeking for routine treatment, this means that you're not experiencing any symptoms. You are just consulting for a routine checkup, and this will cover things like physical screenings and blood work. So to understand that difference, the standard plan only covers for medically necessary treatment. So if you're experiencing symptoms, this plan, the standard plan, also has a 10% co-insurance for outpatient claims. So for example, if you have a $100 invoice, SafetyWing will be responsible for $90 of that invoice, and you will be responsible for the remaining $10. So the following benefits are only included on the premium plan. So you have $1,500 for dental. This is for things like cleanings, checkups, or treatments like crowns or fillings. For vision, you have $500. This is for eye exams, glasses, or contact lenses. Screenings, here you also have $500, and this is for any preventive services. So anything that it's routine, so annual blood tests, physicals, or any other checkups. I'm afraid there are some exclusions in remote health, and I want you to know how it works. So if you go into our policy document, you will be able to read it, and I promise you, it's super simple to read. We've made the wording as user-friendly as possible. We know insurance and the wording can be a pain in the head, but no worries. This insurance, I can guarantee you that it's going to be easy to read. So we always encourage people reading it. On the section 7, you will find the exclusions. So how does that work? So for example, if you go there, you will find that one of the exclusions of the policy is that we do not cover for aesthetic treatments. So for example, if I want to go to the dermatologist, that would be covered under the outpatient benefit because it's a specialist and you are allowed to go to specialists. But if the reason why you're consulting that dermatologist is because you want to have an aesthetic treatment, you want to have a better skin, you want to put on some Botox, then that appointment, that consult will not be covered as that is considered aesthetic treatment. Like that, you will find other examples. This is just to give you an idea on how those exclusion works. So enrolling in remote health does require a 12-month commitment. and the cost of the coverage is it's billed monthly. This is super simple, and pricing is really easy to understand. So first, once you understand which plan you want, so the standard or premium plan, you will get to choose it, and and you and your dependents will be able to get it. So it is only based on your age bracket. So if you went with the standard plan and your age is 37 years old, then your monthly bill will be $80. If you want to add your spouse or your partner into your account and it's also under the standard plan and on the same age bracket, then you know you will be paying $160 per month. So how to use the plan? First, the core plan. This, as I said, includes a $1.5 million maximum per year. And this includes coverage for things like emergency room care, hospital stays, surgeries, cancer treatment, and much more. So let me give you an example on how to use it. So let's pretend that you have a surgery for a medical condition. What to do? So first, you call your doctor and schedule an appointment. You will ask your doctor to provide you with any medical notes, the estimated costs of procedure, and any test result that you had from that condition. Then you will go into your SafetyWing dashboard because once you sign in, you will all have access to it. With all of these documents, just fill out the notify form and you will be able to receive an answer in 72 hours confirming that your surgery or your procedure is approved using the outpatient benefit. So this is for medically necessary treatments. And as I said, this is covered in both plans, both the standard and premium plan. And the standard has a 10% co-insurance. So how to use this benefit? This benefit is basically for doctor visits, for illnesses, if you want to see a specialist. That, by the way, if you want to visit a specialist, you do not need a GP referral. You can just go directly to the specialist of your choice and have the treatment that you require. This covers also things like physical therapy, chiropractor visits, psychologist care, and much more. So again, how to use it? It's really simple. Again, first, call your doctor, book your appointment as a private one, and pay for the services, pay for the consult. Keep all the receipts, all the medical notes, the prescriptions, everything that you paid for. And again, go into your SafetyWing dashboard. There you will find that you have a claim button where you will be able to submit all of these documents and you will be reimbursed in the account that you provided in the next 15 days. Obviously, I hope you never end up in an emergency situation, but it's extremely important to know what to do when that happens. So first of all, go to the hospital immediately. We want you to seek treatment and we want you to know that health is the first thing on everyone's mind here. So once you arrive at the hospital, we'll just let us know that you're there. We always encourage everyone on printing out your SafetyWing ID card that is just like the one you see here on the right. You will be able to download it from your dashboard as well. There on the back of the card, you will find all the emergency numbers, the emails, everywhere you can contact us. Just let us know that you're under an emergency, call us there. It can be either you or a family member or someone from the company or someone at the hospital. So just be mindful and always keep it in your purse because I hope this never happens. But in case you are not conscious, when anyone finds this card on you, we'll be able to know who to call. So once we know that you're at the hospital, we will get all of our force working for you. We will make sure that the hospital is connected with us and that we are providing you with the best health care that you need. So we know that sometimes life changes and well, we're here for you. So as you've learned by now, remote health provides you with a global coverage. However, there are some countries that are outside our area of coverage. So for example, if you plan on traveling to the United States, Hong Kong, and Singapore, there we provide of a 30-day maximum for emergencies. So if you end up having an accident there, in any of these countries, you have coverage for emergencies up to 30 days. Also, if you want to add dependents, you will be able to do so while you sign up on your application. You have 30 days to do so from your activation date. After that time, you will be able to add dependents if there is a live qualifying event. And what is that? This means if you got married and you want to add your spouse, your new spouse, or if you had a newborn and you want to add your newborn to the plan, you can also do it in between the plan activation. Just let us know and we will be able to help you out. We are always here for you, and we have a wonderful customer service chat. You will find it on our SafetyWing website. On the bottom right, you will find the chat icon, and it's available 24/7. You will get answers in seconds. And these are people from within SafetyWing, so you can rest assured that you will get the best answers and the more immediate responses that you need. You can also contact us at support@safetywing.com. I also encourage people on visiting our FAQ website. This website is updated every week. So we have really useful questions and really useful answers in case you want to understand a little bit better of the plan. If there is something that I forgot to explain during this presentation, there you can also find a lot of useful information. So if you're still interested in remote health, we encourage you to go to Andela's website, just fill out the form, and you will receive an email from SafetyWing that looks just like this. Uh, Remember, click on activate your coverage and follow up the steps on the email. You will need to provide your personal information as your contact information, and you will get to choose your plan during this onboarding. And well, once you are logged in, once you accepted our plans, this is how you will be able to use our dashboard. So first of all, log in with your email and the password you created. You will get to personalize your emoji if you want. This is just like a SafetyWing branding thing that we love, and we want you to feel a part of us. So you get to create your bird avatar. Once you want to go into your plan, just click on the purple button that says remote health, and under my insurance tab you will be able to see that your plan is active, which benefits you have, and you can hover over the question mark if you want a little bit of information around it. As I said, you will find the policy document. You can just scroll down, read it out. Once again, I encourage you to do so. It's really simple and it will give you a better understanding of the policy. Then here you will find an infographic that will explain you on how to use the insurance. So first, pay and claim, or direct billing, or pre-approval. There you find the link for the pre-approval and direct billing requests. So just click there and fill out the form. Here you also find the make a claim button, where you will just submit all the documents you have from the consult so you can be reimbursed. As I told you, you have access to your own personal card on your website with all the contact numbers on the back, and you can also print it out. We encourage you to do so so you understand what is there. So that is basically it. First of all, thank you. Thank you very much for having me here. And well, let me know if you have any questions.
Amazing. Thank you so much, Mar. This was a great presentation. So I'm sure folks probably have a lot of questions. People are usually shy, as my experience shows. But we're gonna go ahead and address some questions that already came in. If we don't receive any more, we'll just go through a list of questions that I have received on my end from Pakistan, and we can address those. So just a reminder, you guys, if you have any questions, you can submit them right now via the QA tab on the very top, on the right, on the left top, in the left top corner. You can also just post them under the chat tab as well. So let's see. So we had a question from Wasif. Um, Hey Wasif, how's everything in Lahore, by the way? So the question is, I joined Andela at the start of this year. I don't have a deal account, nor am engaged in any opportunities yet. How should I access health insurance? So that's a great question. So first off, the health insurance options with SafetyWing are available to anyone who is within the Andela network. In other words, if you have an Andela domain email address, you are eligible for it, and it doesn't matter if you are currently on an active engagement or actively looking for to be placed with the client. All it matters is that you are in the network, and that's everything we need, right? The whole idea behind the health insurance program is to essentially provide you with available options or give you access to those health insurance options because we want to support the people in our network, our community. So it doesn't matter if you're on a current engagement or not. Now, you can, so Wasif, you can go through the health insurance page and submit your request. I think you already done that. So you should have received an email from SafetyWing, just the same one that Mara went through. And so that's an invitation email. Once you open it up, you will click on it and then you can provide your information and stuff like that. It's important to know that I see your second question about how can I pay for the insurance plan and how do I get the reimbursement. So Andela is not able to sponsor the health insurance premiums at this time. So when you select the plan, let's say you selected the standard plan, and if you're between, I'm not sure how old you are, but if you're between 18 and 39, that would be, I think, $80 a month. So it would be, if you're signing up for a plan, you will be signing, basically committing to a year, but then you would be required to make a payment once a month. That would be, yeah, $80 here. Thank you, Mark. And then you submit the payment in the SafetyWing platform and your policy gets activated. Now, there are 2 dates in the month where the policy can get activated. So I'll let Marta speak a bit about it just in a bit. And so just to address specifically your question, there is no reimbursement, right? So once you pay the premium yourself, let's say you decide to go for a standard plan, $80 a month, you pay the premium, your policy is activated, and then go see a doctor or like whatever your case is. Um, and that's pretty much it. But now when you use a service, right, and you need to submit a claim for reimbursement, um, I'm also going to let Mar talk about that process as well. That's where the reimbursement comes into place for a specific claim. But Andela is not reimbursing any premiums that people have to pay for health insurance, right? Essentially, the work we've done here is that we negotiated down the premiums. Those are actually super good rates. You would not be able to get those rates anywhere else with SafetyWing. Their rates are usually much higher. So those are really good terms already. And in Pakistan, I also know that as an individual, you can't really come up to a company and ask them to sell you an individual health insurance policy. You have to be represented by a company. So again, this is super valuable to our contractors in Pakistan because at least this way you get access to health insurance, right? You can protect yourself, your family, and so that's the whole benefit there. And now I see your third question about can I access health insurance now and pay later after starting the first assignment? Um, I don't think so, but I'm gonna let Mark speak to it. I think you will be required to make a payment first, and then the policy is activated. So, Mark, can you talk about the 2 days when the policy is activated in the month, and then the claims reimbursement, to make sure that we touch on those questions that came in?
Of course. So when you are onboarding, you get to select your start date. It can either be the 1st or the 15th of every month. You can decide which date you want your insurance to start. Once you complete the process, you will be asked to provide your credit card information, so we can deduct the price of it from your card. As any insurance, the prices have to be paid before using the insurance. So it's actually paid before. So no, we cannot have the payment done just once you receive like a job or something like that. But we can guarantee you that if you complete the process and you want to have coverage, you can have it with us just on the 1st or 15th of every month. Just let us know when you want to have coverage, and we're there for you. And also, let me go back to the reimbursement. That maybe there was like a small confusion. So
Mm-hmm.
reimbursements work on the claims process. So once you have gotten to the doctor, you paid for your consult, you paid for your medications, you pay for the treatment you require. That is small amounts, of course. If you don't want to pay out of pocket and you want SafetyWing to pay directly to your provider, we can do so if it's over $250. But you have to get the notify form, and you need to wait for the pre-approval. So with the reimbursement, it's just that you will be reimbursed whatever you paid for, and you will receive it on the account that you provider on the claim form.
Mm-hmm. And how long does it more usually take for the reimbursement to come in after
Well,
they
we have a
submit the claim? Mm-hmm.
Yeah, we have a policy. On our policy, it says that maximum 15 business days. I can
Mm-hmm.
guarantee you that it's going to be way faster than that. And especially since we're working on creating this process much, much better. And you will
Mm-hmm.
see a lot of improvement in just a few weeks.
Mm-hmm.
So you don't need to worry about it. You will have your reimbursement within those first 15 business days.
Yeah, I heard through a grapevine, Vine, aka your product manager Aaron, that that process has been already shortened to just like about a week or so.
Yes.
So it seems like you guys been doing great work there. In terms of the direct billing, how does it work? How can people set up direct billing? What would they have to do if it's over
So
$250?
of course. So direct billing is basically this this process. So you go to your doctor and you make sure that you have all the documents that you need. So, for example, if you got prescribed a surgery or you need to have any type of bigger treatment, what you need to do is collect all those documents. So, if you need a knee surgery, then any type of test that led to the prescription, any medical notes with the prescription of the surgery, um, the estimated costs of the procedure. And once you have all of these documents, you just go onto to the notify form. I tell you, this is only 5 questions. It will you will answer that in less than 5 minutes and provide all the documents. The most important part is the documents that you submit. So be mindful to have all of them handy. And once you upload them, you will have an answer in 72 hours confirming first that your appointment is approved, and we will get in contact with the provider that you selected, so we can pay them directly, and we will let you know once the provider has accepted as well the payment from us, or from SafetyWing.
That's awesome. Well, Steve, I'm actually seeing your, I just saw your message on Andela chat, by the way. It seems like you submitted the request, but you didn't receive a form, the email from SafetyWing. So I'm looking at the dashboard right now, and it looks like you are in the processing status. So it looks like you already clicked on the email and maybe even started filling out, like going through some of the steps. Can you let me know if that's the case? If not, I can make sure that you receive a new invitation email from Andela. So great. So I don't see any other questions that came in yet. So we're just gonna go ahead through the list that I had received before. I think Mara, you touched on it a little bit. I think there was a question: do I need pre-authorization to visit a specialist?
So you do not need a pre-authorization to visit a specialist. You do not need for any specialist visit. You can just go there, uh, choose the one you want, go there and have your treatment. Uh, but there are some cases where you do need pre-authorizations. This is for things like for hospital admissions. If you're going to have a surgery, you need to have a pre-authorization. For any medical equipment, so for example, you ended up in an accident and you need like a wheelchair or something for your mobility, these type of things need to have a pre-authorization. So just be mindful to fill it out. You will find all of the pre-authorization section on our policy document on the section 9.1. and it will give you just a broader expectation on when you need it. But if you want just to go to your psychologist, or just to go to your I don't know, like the rhino or any type of doctor, you can just directly go there and you will be able to have your treatment.
Got it. Okay, perfect. That sounds good. Are there any waiting periods?
So with SafetyWing, you
Hmm.
do not with remote health, you do not have waiting periods for using, for example, your dental treatment, because usually
Hmm.
we had those. But right now, with this new partnership and with this new product, you can guarantee that you can go and visit the dentist as soon as you want. You can visit the doctor immediately after you onboarded with us. So no, we don't have waiting periods.
Okay, that's amazing. It's actually great, especially on individual policies. Usually there is at least like a 30-day waiting period for new entrants on the policy, like pre-existing conditions, 1 year waiting period, maternity, at least 1 year as well. So those are great terms. So you guys can get access to healthcare as soon as you sign up. Isn't that a dream? All right, so let's see. Was another question about has to do with visas. So I guess when people travel, so let's say someone is based out of Pakistan and they would like to travel to, I don't know, the UK or somewhere in Europe. And my understanding is that people would have to kind of submit the paperwork and get a visa to go to Europe. And so folks are asking if this coverage, health insurance coverage, would be sufficient for the visa purposes, because I think they have to submit some sort of confirmation or a document confirming that they already have health insurance coverage when applying for a visa, and that's how it gets approved and stuff like that. Would that be enough? Would having this coverage would be enough for that?
Uh, yes, or you can just go into our chat and request for your visa letter or and your certificate of coverage. We will send it to you immediately, and there, with that document, you can prove your insurance that you have worldwide coverage. So you have no problem with this document during business.
Okay, awesome. So you guys can provide just like an official safety wing stamp letter saying that the coverage, and that should be enough. That's great.
Exactly.
Oh yeah, and since we're on this topic, what's available to folks abroad when they travel? Do they have access to the same benefits and stuff like that, or those are a little
So we are covering in over 175 countries. So the coverage works exactly the same no matter where they go. So if, for
different?
example, I want to go to I am in Portugal and I want to visit the dentist there because I don't know, it's the dentist that I
Mm-hmm.
like visiting. I can have my dentist appointment in Portugal. But then I want
Mm-hmm.
to go and visit the family doctor in Germany because that's the one I've been visiting for a long time. So I go there.
Mm-hmm.
And all of these appointments, regardless or where you go, you are covered exactly the same. It works exactly the same in
Mm-hmm.
Pakistan or in any other country. This is not a travel insurance, meaning
Mm-hmm.
you don't have like coverage for like delayed flights or luggage or things like
Mm-hmm.
that. But we can guarantee you that we care for your health and you have the same
Mm-hmm.
coverage in any of these 175 countries.
Honestly, Mar, if I didn't work for Andela and I was an independent contractor and just traveled around the world, I think I personally would sign up
That's
for
amazing. That's
this.
amazing. I'm
Yeah,
happy to
no,
hear
because
that.
it's so cool, especially like if you travel, like I feel like nowadays, the whole world has gone online, like you don't really have to be in the office. And I think especially like the sort of younger generation, there's so much flexibility and freedom. You can literally like, work in one place for a month, to another one and stuff like that. But health insurance is super important. And it also depends on the country, of course. Sometimes it's like a little cheaper, sometimes it's more expensive. Europe is definitely a little bit pricier. God forbid have to see a doctor in the US. That's like a whole deal there. But it's really cool that you can use the same benefits no matter where you go, essentially.
Exactly. It's definitely a great
Yeah,
opportunity. And yeah, we're trying to make this the normal, the new normal, because when does your health stop if you just cross a border? It doesn't make
yeah,
any sense. So we just want you to feel like with exactly the same coverage regardless of or where you are.
Yeah, and borders is such an illusion. I hope like 100 years from now we're
Exactly.
not gonna have any borders. So dumb. Makes no sense. Okay, well, let's see. There was another cool question too that came in. Do I need to have the receipts and medical notes translated in order to make a claim? So that's a, yeah, especially like in non-English speaking countries, which Pakistan is one of them. Do you guys have a team of like translators that can help, or how does it work?
Yes. You do not need to worry about that regardless of the language you have your documents. Just be sure that you're providing the documents required. So prescription, medical notes, anything, any medical notes that describes the reasons or the symptoms that you were experiencing when you visit the consultation, and just submit it. Regardless of the language, we have a team that will translate them, and we'll have that the procedure approved. So that's also like a useful tool for everyone.
Okay, perfect. That's awesome. And so I know you guys don't really have any limitations on hospitals or providers people can use, essentially whatever hospital they want to be at or go to, that's totally fine. But there was a question, it's like kind of causes a bit of confusion because even though we specify it, then they recap and they outline the benefits and stuff like that, people still ask, oh, but what hospitals are covered? Is there any sort of like a list or a directory where people can refer to, or how
Well,
does it work? How?
we can provide you with a list of hospitals that we've worked in the past.
Mm-hmm,
Still, this doesn't limit your choices. Again,
mm-hmm,
and I will never get tired of repeating this because I think this is the best like advantage of SafetyWing and remote health, and it's that you literally can visit any licensed provider in the world. So if
mm-hmm,
you like this specific doctor, go directly to him. You do not need to ask if it's covered or not, because as long as the doctor or the provider is licensed, it's covered under the policy. Obviously, it's everything is can be judged by the exclusions, but as long as it's not part of the exclusions, every doctor is covered there. So just feel free to visit the hospital where you feel most comfortable with. I personally feel really comfortable at private hospitals, and I know that I will get like a premium service, and this is what we are offering you, a premium service. And we know how like stressful it can be when you have an illness or you're experiencing some type of disease or anything. So it's always good to know that you can visit the best doctor from your town, the best doctor
mm-hmm,
from your country, or if you want to visit in a different country, you are also entitled to do so. So just feel free and
mm-hmm.
just make sure that you feel the most comfortable where you're having your treatment.
Absolutely. Well, this is amazing. I just wanted to guys give you a quick recap of the key highlights with SafetyWing before I let you go. So, they just one thing to make sure that once you sign up for a plan, you commit into a year coverage, and you don't have to pay your premium upfront for the whole year. You can just pay it monthly, and that's a great way to sort of break up the payment and kind of helps you to manage your finances a little better. So just monthly payments there. Super important, no waiting periods to access healthcare. As soon as you provide the payment and your policy is activated, you are covered right away. You don't have to wait any time to access healthcare. It's super important to Andela that there are no waiting periods there as well. And so we are super excited to see those terms being in effect. And one important thing too, no waiting periods and full coverage for pre-existing conditions as well. Now, so if you have any sort of kind of, major concerns with your health and you want to ensure that you are protected and covered, this is a great option for you to go for because usually even if you set up an individual policy, if you were able to find individual policy in Pakistan, which it's not the case, there is still at least a 1 year waiting period. But SafetyWing, there are no waiting periods, so that's amazing. Now the inpatient outpatient care, for inpatient care you have a limit up to $1.5 million, right? So that's more than enough coverage in this particular market. For the patient, you have a limit up to $5,000. So if you had to see a specialist and whatnot, um, that should be enough. Also, if you find yourself traveling, right, coverage is this coverage works in basically anywhere in the world, right? You don't have to be in Pakistan. Let's say you decide to spend a month working from India, maybe, or go to Europe, or maybe you travel on vacation and you know something comes up, or you just want to see a specialist there. This is the coverage that will be perfect for that as well. Now, we just talked about it too. This coverage is available at any private or public hospital. Essentially, what it means that you can go to the the most fancy hospital that there is that you want to go to, and you will be covered. So you don't have to compromise on the quality of medical care or the providers and stuff like that. You just get the best of the best with this coverage, and that's really amazing as well. Direct billing is available to you for claims over $250. You will just have to contact SafetyWing beforehand. If not, claim reimbursement process is super fast, super easy. Shouldn't take more than 2 weeks. Will likely be much faster than that. Last I heard, it was about a week. And then if you decide to go for the premium plan, where dental and vision care are available, the dental limit is $1,500 per policy year. Vision care is $500. So that should be more than enough to, do like dental cleanings, regular checkups and stuff like that for vision, um, all the same stuff too. So these are, I think personally, those are amazing benefits that come with the SafetyWing standard and premium plans, and you should definitely take advantage of them, especially if you're actively looking for health insurance policy, especially if you have a family, maybe have some travel plans coming up and stuff like that. That should work pretty great. I don't see any questions coming in, so with that, I think we're just gonna wrap up for today. Thank you so much, Mar. Thank you, Daniel, for helping us run this webinar. Really appreciate your help. I will send you guys an email or communication with the recording of the webinar and the helpful links where you can submit a request for health insurance policy, learn more about the plans and stuff like that. Another thing to note, if you have any more questions or maybe you were shy today on the call, if you want to, Mar is actually Mar has a calendar link where you can set up a one-on-one with her, and she can talk you through the plans. Maybe you can even discuss which one works best for your particular needs and stuff like that. So that's available to you as well. And I'll go ahead and share that link too. So if there are any more specific questions you want to address, that's Mara is a great resource, and she's here to address all the questions and concerns. She's here to help and make sure you're successful in your health insurance journey with Andela. Alrighty, well, so that's pretty much everything for today. Thank you so much, guys. Mar, did you have anything you wanted to add before I let everyone go?
No, I think we covered everything. And yes, just encourage people if they have more questions, if they want to reach out to me directly,
Mhm.
feel free to do so. Stan can share with you the calendar link. And well, I'm at your disposal. However, I can help you and guide you. I'm more than happy to do so. Well, it was lovely
Awesome.
being here, and thank you, Seth, for inviting me.
Of course. Thank you so much, Mar. Thank you guys for joining, and I'll talk to you soon. Cheers.